In this lesson, we're going to talk about pain and non-pharmacological pain measures. When we look at our patient's pain, we have to remember that it's a subjective thing. It's whatever the patient tells us it is. So what we have to try to do is reconcile that what they're telling us their experience with something objective so that we can actually treat them. We'll talk about how all that works a little bit later in this lesson, but what I want you to remember is that pain is what the patient says it is. Pain can be acute or chronic or both. So if it's acute pain, that means it's been a relatively short amount of time that they've had it. It can be really intense and it's affecting almost every aspect of their life. Chronic pain is, it doesn't affect their life any less, but just remember that this is a long duration. And so the qualities of the pain can be a little bit different than acute pain. And then sometimes they can have both, meaning a patient can have like low chronic back pain and then they experience a new back injury. So they can have actually both types. Pain is also going to be different for every patient. Some people tolerate a lot of pain and some people can't. And what that means is that you're going to have to try to key into what your patient's telling you so that you can really manage their pain in the best way possible. You can't truly understand your patient's pain unless you can assess it. Pain assessment isn't just about a number. It's a multifaceted assessment. There's a lot of different factors to it. And the best way to assess your patient is probably going to be to look at either one of these two mnemonics. So you have old carts and OPQ-RST. And I'm going to cover both of these briefly, but what I want you to understand is that in order to get a better understanding of our patient's pain, we have to look at different aspects of pain from the patient's point of view to get a better idea as to what interventions are actually going to work. When we look at old carts, we're looking at onset. So when did it start? Location, where does it hurt? Duration, how long has it been there? How long does the pain last? Character, is it dull? Is it sharp? Is it throbbing? Does it ache? When we talk about alleviating or aggravating factors, so is there anything that you can do to make it better or worse? Radiation, does it go anywhere? Does it spread anywhere? Timing, is there a time of day where it's better or worse? And then severity, this one's going to be the one that you ask. So give me 0 to 10. 0 is no pain, 10 is the worst pain in your life. Oftentimes what I'll say is 0 is no pain, 10, I've ripped your arm off and beat you with it. So that's 0 to 10 pain. And 0 to 10 pain is different for everybody, but severity is kind of give you your number, but then you use all this other information to really figure out what kind of pain they're having. In the OPQ-RST method, you're going to look at similar things. So onset, anything that makes it worse, what kind of pain is it, where is it at, or where does it spread? Again, severity, and what kind of time factors are we looking at? So is there a time where it makes it better? The time that it's worse. So like cold weather can sometimes offset that. But these are the things you need to look at. And as you can see, pain isn't just a number. Pain is something that's really complex and that we need to drive home, that we really need more information so that we can help our patients out a lot better. And when we talk about pain management and pain goals, what we're going to need to do is first off, tell your patients you're not going to be able to eliminate their pain. You can't take it all away, but what you want to do is focus on managing their pain. You want to make it tolerable. You want to make it to where they can get out of bed and do regular things, but set the expectation early. Set it, and also make realistic goals. You want to focus on things first, like non-pharmacological interventions. So these are things like, we'll write some of these down. You've got guided imagery. You've got massage. You've got heat and ice. These are ways that you can alleviate pain and do it without the use of medication. The reason I bring these up is I want you to put them in your nursing toolbox. I want you to have it in there and say, look, I can't do this. What do I have in my toolbox that I can use and help this patient out in case your patient's having like a pain breakthrough, so that you can do something in the meantime for them while you're working on getting them the appropriate medications. Now, when you're talking to your patients about pain, you need to make sure that you're using the right pain scale. If you have a patient, let's say they're a pediatric, they're not going to understand this 0 to 10 pain scale. They're going to look at something like the Wong-Baker faces, where you've got the 5 smiley faces. So 0 is no pain and they're happy. And then you have crying, right? And this is 10, but they understand these faces in here. So they can tell you kind of which face they're using. So just make sure that you're using the appropriate scale for the patient. One thing I want to drive home is that you should really try to use your non-pharmacological interventions first. So use things like, your massage or guided imagery, and then move up in a stepwise fashion. So let's say you have a patient that has a migraine. If you automatically jump to IV opiates, you can't go any higher. Like, you're already there. And patients often with migraines may complain about like lights that are too bright or noises. So turn off the lights, turn down the TV. These are things that you can do without using medications. If your patient's not responding to these non-pharmacologic interventions, what you can do is step up. So now try your non-opiates. So these are your NSAIDs, your non-steroidal anti-inflammatory drugs. Try these first. And then if that doesn't work, then you can consider opiates, your oral opiates. And then if those don't work, then you move up to your IV opiates. But once you hit those IV pain medications that you can't go any higher on, just know that like they can't top out. Now, the other thing that you need to consider is your drug onset. So if you have a patient that's about to get a dressing change in 10 minutes, and it takes 30 minutes for your pain medication to work, this is not going to work. Your patient's going to be in pain. So think about your time management whenever you're dealing with pain medications. You want to make sure that you're also considering the medications are on, considering what options you have, because the last thing you want to do is be in the middle of something really painful, some kind of really painful dressing or procedure, and you don't have the appropriate medications. The other thing you want to talk about is de-escalating. So let's say your patient's at a 10 and you're giving this IV medication. Well, you have to explain to them that they're not going to be able to go home on that IV medication. So you want to start implementing your oral opiates at, let's say they're at a 7. And then you want to start doing your NSAIDs down here at maybe a 3. And what you want to try to do is start stepping them down this way, because their pain thresholds are going to be better. They're going to have better pain control. You can start, following the orders by like alternating some of them or starting them at different times, and talk to your providers about how to best manage your patient's pain when you're doing things like implementing different types of medications. But the thing that you want to note is you want to get these patients down to the lowest kind of control possible, because they can't go home with the IV meds. So just educate your patients, start talking to them early, and start working towards managing your patient's pain. Our nursing concepts for today, when we're dealing with pain, are really about comfort and focusing on your patient. Also, we also focus on health promotion through pain management. So let's recap. First off, pain is subjective. It's what your patient says it is. Pain is different for everybody, so make sure you ask them different questions about what their pain is like so you can get a better understanding. Set realistic expectations for your patient. Remember, you can't eliminate pain, and you want to focus on your patient's pain management. Lastly, use your non-pharmacologic interventions. Then you can step up to the big guns if you need to. That's it for our lesson today. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.